Look closely at the back of your hand for just a moment. Now flip your arm over and look at the soft skin on the inside of your upper arm, near your armpit. Think about what you're seeing. Both areas belong to the same body. They've lived through the exact same number of birthdays, the same seasons, the same decades. Yet one is often covered with brown spots while the other remains smooth and clear. If aging alone caused those marks, they would appear everywhere, but they don't. Instead, they gather on the backs of your hands, your forearms, your face, and your chest, the places that have quietly absorbed sunlight year after year without you giving it much thought. That simple observation changes everything people have been told about so-called age spots. I'm Dr. John Meyers, and today I want to share 5 important truths about these brown patches that most people never hear. It isn't because doctors don't care. It's because a routine appointment rarely allows enough time to explain what is really happening. Most visits go the same way. You point to a spot on your hand, your doctor glances at it, says it looks harmless, calls it an age spot, and moves on to the next concern. In most cases, that answer is completely correct. The spot is harmless. But harmless does not automatically mean permanent. Those two ideas have somehow become mixed together, and that's where many people stop asking questions. Before you assume this is another lecture that ends with just wear sunscreen, stay with me. Sunscreen is important, but it's only one piece of the puzzle, and surprisingly, it isn't even the first thing you need to understand. In fact, one of the biggest reasons it works has almost nothing to do with preventing sunburn. By the end of this discussion, you'll understand exactly why those spots form, what you can realistically do to fade them, and how to recognize the one brown mark that should never be ignored. To understand what's happening, we have to start beneath the surface of your skin. Deep within the lowest layer are tiny cells called melanocytes. Their job is to produce melanin, the natural brown pigment that gives skin its color and helps protect it from ultraviolet light. Normally, these cells work like a well-managed factory. When your skin is exposed to sunlight, they receive a signal telling them to make more pigment. That extra melanin is passed upward into the surrounding skin cells, creating what we recognize as a tan. Later, as old skin naturally sheds, the pigment disappears along with it. That's how healthy skin is designed to work. But creating a permanent brown spot requires 2 separate problems to happen at the same time. The first involves the signal itself. Melanocytes don't produce pigment randomly. They rely on instructions delivered through an important enzyme known as tyrosinase. Think of tyrosinase as the master switch that tells pigment production to begin. Ultraviolet radiation can flip that switch on, but it isn't the only trigger. Ongoing inflammation can do it too. So can oxidative stress, the gradual chemical damage that quietly builds inside every cell of your body over many decades. After 60 or 70 years, some pigment-producing cells stop behaving normally. Instead of switching off after sunlight exposure ends, they remain active, continuing to manufacture pigment long after they should have stopped. That's only half the story. The second problem involves your skin's natural cleanup system. Throughout your life, your skin constantly renews itself. Fresh cells form underneath while older ones slowly rise toward the surface before eventually flaking away. In your 20s, this entire process took roughly a month. By the time you reach your 60s, according to the National Institute on Aging, that cycle often stretches to nearly 2 months or even longer. Suddenly, pigment that once disappeared quickly remains trapped in the upper layers of your skin for weeks beyond its normal schedule. When too much pigment is being produced while old pigment is being removed more slowly, the result is the brown patch staring back at you from your hand. Every successful treatment you've ever heard about, whether it's an inexpensive bottle from a pharmacy or an advanced laser procedure, works by targeting one of these 2 problems. It either reduces the signal that tells pigment to keep forming, or it speeds up the process that removes pigment from the skin. Those 2 ideas, reducing production and increasing clearance, are the foundation for everything we're about to discuss. Over the next few minutes, I'll walk you through several approaches that work from these exact principles. We'll look at an inexpensive ingredient available in most drugstores that helps shut down pigment production. We'll discuss a prescription cream supported by decades of scientific evidence that surprisingly few adults over 60 are ever offered. We'll talk about one sunscreen mistake almost everyone makes without realizing it, a mistake that has little to do with getting sunburned. And finally, I'll show you an incredibly simple fingertip test that takes less than 10 seconds and can help you recognize the difference between a harmless age spot and one that deserves immediate medical attention. Before we get into those practical steps, there's something important I want you to understand. Everything we're discussing about your skin reflects changes taking place throughout the rest of your body as well. Oxidative stress, low-grade inflammation, and slower repair mechanisms aren't happening only on the surface. They're affecting your blood vessels, your joints, your muscles, and even your brain. Your skin simply gives you a visible window into processes that are otherwise hidden. In many ways, those brown spots aren't just cosmetic changes. They're reminders of how the body responds to decades of living. That's why I always encourage my own patients to think about healthy aging as a whole body process rather than focusing on a single symptom. Understanding what happens beneath the skin often leads to better decisions everywhere else. Let's begin with the first truth, and it's one that clears up a misunderstanding that has existed for generations. These marks are properly called solar lentigines. The word solar tells you exactly where they come from, the sun. Yet somewhere along the way they became known as liver spots, a name that has frightened people unnecessarily for decades. Despite the name, your liver has absolutely nothing to do with these patches. They are not signs of liver disease. They don't indicate poor liver function. They have no connection whatsoever with how your liver works. That old label simply survived long after medical science proved it wrong. What these spots actually represent is a long-term record of sunlight exposure. Every brown patch marks an area where ultraviolet light repeatedly landed over many years. That's why they appear on the backs of your hands instead of the backs of your knees. Your hands have spent decades gripping steering wheels, gardening outdoors, resting beside sunny windows, carrying groceries, walking dogs, opening mailboxes, and performing thousands of everyday tasks beneath daylight. The skin has simply been keeping score all along. The encouraging part is that these pigment-producing cells haven't become something entirely different. They're still living cells capable of responding to new instructions. They're simply overactive. Likewise, much of the pigment they've already produced remains trapped because your skin isn't clearing it as efficiently as it once did. That means both opportunities still exist. You can reduce the signals encouraging excess pigment, and you can improve the skin's ability to remove what has already accumulated. Unfortunately, very few patients ever hear this explanation during an ordinary doctor's visit, and it isn't necessarily because their physician lacks interest. The healthcare system simply isn't designed to reward lengthy conversations about pigment biology. Insurance companies generally classify age spots as cosmetic concerns rather than medical problems. As a result, there is little time built into appointments for discussing how pigment forms, why it stays, or what realistic treatment options exist. Many patients leave believing nothing can be done simply because the conversation ended before it truly began. That assumption deserves to be challenged. There is, however, one important exception you should always keep in mind. While sunlight causes the vast majority of age spots, not every case of skin darkening comes from ultraviolet exposure. Several commonly prescribed medications can produce increased pigmentation entirely on their own. Drugs such as amiodarone, often used for heart rhythm disorders, long-term minocycline therapy, hydroxychloroquine, certain chemotherapy medications, and even some anti-seizure drugs have all been associated with changes in skin color. If dark patches appeared rapidly over several months instead of gradually over many years, or if they developed in areas that rarely receive sunlight, don't simply assume they're ordinary age spots. Bring your medication list to your pharmacist and ask one direct question. Could any of these medicines cause hyperpigmentation? It takes only a minute or two, costs nothing, and yet surprisingly few people ever think to ask. Sometimes that simple conversation provides an answer that years of guessing never could. The second important truth begins with the same enzyme we discussed earlier, tyrosinase. Remember, this enzyme acts as the master switch for pigment production. The encouraging news is that science has identified several ingredients capable of reducing its activity, and many of them don't require a prescription at all. Among the safest and most reliable is niacinamide, the active form of vitamin B3. Unlike harsher treatments that aggressively attack pigment cells, niacinamide works more gently. Instead of stopping melanin production completely, it interferes with the transfer of pigment from melanocytes into the surrounding skin cells, where discoloration actually becomes visible. In other words, the pigment is produced but struggles to reach the surface where you notice it. Research published in the British Journal of Dermatology has supported its effectiveness for years, and dermatologists continue recommending it because it combines results with excellent tolerability. A 5% niacinamide serum applied each evening can also calm inflammation and strengthen the skin barrier, two benefits that become increasingly valuable as skin naturally becomes thinner and drier with age. Other ingredients, including azelaic acid and stabilized vitamin C, offer additional ways to reduce pigment production while helping combat oxidative stress. None of these products perform miracles overnight, but when used consistently and patiently, they work with your skin instead of against it. One of the biggest mistakes people make is expecting decades of accumulated pigment to disappear in a matter of days. Unfortunately, that simply isn't how skin biology works. Even the most effective non-prescription ingredients need time to interrupt pigment production while your skin slowly replaces the older, darker cells that have already reached the surface. In most cases, you're looking at roughly 8 to 12 weeks before noticeable fading begins, and even then, the goal is improvement rather than complete erasure. Anyone promising to eliminate 40 years of sun damage with a miracle cream in 2 weeks is selling hope instead of science. Healthy skin changes gradually, and lasting improvement almost always comes through consistency rather than speed. That's why patience becomes just as important as the products themselves. Many people give up after only a few weeks because they expect dramatic results. The reality is that the skin is following its own biological schedule, not the timeline printed on a marketing label. If you remain consistent, you give those pigment cells time to quiet down, while newer skin slowly replaces what has been sitting there for months. There's another piece of this puzzle that often goes completely unnoticed. Sunlight isn't the only thing capable of keeping tyrosinase switched on. Chronic, low-grade inflammation can do exactly the same thing. That's why even a seemingly minor injury can leave behind a stubborn brown mark, especially after the age of 60. A mosquito bite, a small scrape while gardening, a burn from touching a hot pan, or even a patch of skin you've scratched repeatedly can all trigger what's known as post-inflammatory hyperpigmentation. Instead of disappearing once the wound heals, the inflammation continues signaling melanocytes to produce excess pigment long afterward. As skin ages and healing naturally slows, those brown marks can linger for months or even an entire year. That's why constantly picking at your skin, rubbing rough patches aggressively, or using harsh scrubs often creates the very discoloration you're trying to avoid. Gentle care is far more effective than aggressive treatment. Every unnecessary injury gives pigment-producing cells another excuse to remain active. Since we're discussing products that influence pigmentation, there's one ingredient that deserves a careful and balanced conversation: hydroquinone. It has been one of the most extensively researched skin lightening ingredients ever developed, and when used correctly under medical supervision, it can be remarkably effective. However, that doesn't mean every bottle carrying its name is a good choice. The U.S. Food and Drug Administration has made its position very clear. Over-the-counter hydroquinone products are not FDA approved, and in recent years the agency has taken action against companies continuing to market them without proper approval. One of the primary concerns is a rare but permanent condition called ochronosis, where the treated skin develops a bluish-black discoloration that can be far more difficult to manage than the original brown spots. Prescription-strength hydroquinone, prescribed by a physician for a limited period and monitored carefully, remains a legitimate medical option. But random products purchased online or sitting on store shelves are a different story altogether. Personally, those are not products I would recommend placing on the backs of your hands or your face without professional guidance. When it comes to your skin, safer, slower progress is almost always preferable to taking unnecessary risks for faster results. Now let's move to the third truth, because this is where many people unknowingly undo every bit of progress they're trying to make. Almost everyone has heard the advice to wear sunscreen, but for decades that recommendation has been explained in a way that misses the real issue. Most people connect sunscreen with preventing sunburn. As a result, many older adults assume that if they no longer burn easily, they don't really need daily protection. Unfortunately, that's exactly where the misunderstanding begins. The ultraviolet radiation responsible for sunburn is primarily UVB. It's the part of sunlight that turns your skin pink after spending too much time at the beach. Brown spots, however, are influenced much more by UVA radiation. UVA behaves very differently. It penetrates deeper into the skin, quietly stimulating pigment production without causing immediate pain or redness. You don't feel it. You don't notice it, yet it's working all the same. Even more surprising, UVA remains relatively consistent throughout the day and across the seasons. A cool February morning can expose your skin to nearly as much UVA as a sunny afternoon in July. Unlike UVB, which varies greatly depending on the season and time of day, UVA is always present. That's why many people continue accumulating pigment even when they believe they're safely avoiding strong summer sunshine. One of the most unforgettable demonstrations of UVA damage came from a photograph published in the New England Journal of Medicine in 2012. It showed a 69-year-old delivery driver who had spent 28 years behind the wheel of a truck. The side of his face closest to the driver's window looked dramatically older. Deep wrinkles, thicker skin, and heavy pigmentation covered one side, while the opposite side appeared decades younger. Nothing else about the man was different. He had the same genetics, the same lifestyle, the same diet, and the same age on both halves of his face. The only meaningful difference was years of sunlight passing through the side window of his vehicle. That image became a powerful reminder that ordinary window glass blocks most UVB rays but allows a significant amount of UVA to pass through. Every drive to the grocery store, every commute across town, every hour spent sitting beside a bright window quietly adds to the lifetime record your skin keeps. Even the window above your kitchen sink contributes more than most people realize. Clouds don't stop UVA either. On overcast days, those rays continue reaching your skin almost as effectively as they do under blue skies. That's why the recommendation shouldn't simply be, wear sunscreen at the beach. The better advice is much simpler and much more practical. Apply a broad-spectrum sunscreen with an SPF of at least 30 every single morning, and don't stop at your face. The backs of your hands deserve exactly the same protection. Ironically, they're often the very first place people notice signs of aging, yet they're also one of the most frequently forgotten areas when sunscreen is applied. We protect our cheeks, forehead, and nose while leaving our hands exposed day after day. Over time, those missed applications become visible. There's another detail that many physicians never have enough time to explain. Ordinary visible light, the daylight your eyes perceive even when you're indoors, can also contribute to pigmentation in susceptible individuals. Traditional sunscreens aren't especially effective at blocking visible light. However, mineral sunscreens containing iron oxides are. That's why tinted mineral sunscreens have become increasingly recommended for people struggling with stubborn hyperpigmentation. The tint isn't simply cosmetic. Those iron oxides create an additional barrier against wavelengths that standard sunscreens often miss. If fading pigment is your goal, choosing a tinted mineral formula can make a meaningful difference. Without that daily protection, you're essentially asking your treatments to work overnight, while fresh pigment continues forming every afternoon. Lowering the pigment signal, that's the entire purpose of this step. Now we arrive at the fourth truth, and this is where many people understandably become frustrated. The treatments we're about to discuss aren't experimental. They're not cutting-edge discoveries available only through expensive clinics. Many have existed for decades and are supported by excellent research. Yet surprisingly few older adults ever hear about them during routine medical visits. Let's begin with tretinoin, a prescription retinoid derived from vitamin A. Its primary benefit isn't that it bleaches pigment directly. Instead, it accelerates your skin's natural renewal process. Remember how we discussed slower cell turnover earlier? Tretinoin helps restore some of that lost speed. As fresh skin cells rise more quickly, the older pigment-filled cells are pushed toward the surface and eventually shed away. In other words, it improves the clearance side of the equation. That's exactly what aging skin struggles to accomplish on its own. The scientific support behind tretinoin is remarkably strong. Back in 1992, researchers at the University of Michigan published a landmark study in the New England Journal of Medicine examining topical tretinoin for sun-damaged skin and solar lentigines. After 10 months of treatment, the majority of participants experienced visible fading of age spots and meaningful improvement in overall sun damage compared with those receiving a placebo. That study is now more than 3 decades old, yet it remains one of the strongest pieces of evidence in dermatology for treating photoaged skin. Despite that, many adults over 60 have never even heard the medication mentioned during an appointment. If obtaining a prescription isn't possible, over-the-counter retinol offers a gentler alternative. It follows the same biological pathway, although it works more gradually and generally produces milder results. Whether using tretinoin or retinol, the key is to start slowly. Applying it just 2 or 3 evenings each week allows your skin time to adapt while minimizing irritation, peeling, and dryness. Because both products increase sensitivity to sunlight, they make daily sunscreen even more essential. That's why everything we've discussed builds on itself. Each step strengthens the next instead of replacing it. Beyond creams, several office-based procedures can target established age spots even more effectively. Cryotherapy uses a brief application of liquid nitrogen to freeze pigment-producing cells, allowing healthy surrounding skin to remain largely unaffected. It's fast, relatively inexpensive, and often completed during a single office visit. Other options, including intense pulsed light therapy and Q-switched laser treatments, use carefully controlled bursts of light that are selectively absorbed by excess pigment. The pigment fragments are then gradually cleared away by your own immune system over the following weeks. For well-established solar lentigines, these technologies remain among the most effective treatments available. Chemical peels provide yet another option by removing the upper layers of damaged skin in a controlled manner, encouraging healthier skin to replace it. None of these treatments suddenly become inappropriate simply because someone turns 70. Yet too often, older adults are never informed they even exist. We'll explore why that happens, and the most important warning sign you should never ignore: the unfortunate reality is that many older adults are quietly overlooked when conversations about appearance begin. Part of the reason is time. A typical office visit leaves very little opportunity to discuss concerns that insurance companies often classify as cosmetic rather than medical. Another part is the way the healthcare system is structured, where treatment codes and reimbursement don't always encourage longer conversations about skin aging. But there's another reason that deserves attention. Somewhere along the way, society began assuming that once people reached their 60s or 70s, they simply stopped caring about how they looked. That assumption couldn't be further from the truth. Wanting to look in the mirror or smile for a family photograph and recognize the person you still feel like inside isn't vanity. It's a natural part of maintaining confidence and dignity. Over the years, many of my patients have apologized before asking whether anything could be done about the spots on their hands. Every single time, I reminded them that they had nothing to apologize for. Caring about your appearance doesn't disappear with age, and neither should your opportunity to understand the options available to you. Now we come to the 5th and most important truth, the reason I wanted to make this entire video. Not every brown mark that appears on aging skin is simply an age spot. While the majority are completely harmless, some deserve prompt medical attention, and learning to recognize the difference could make an enormous difference to your health. Fortunately, there's a remarkably simple way to begin evaluating many of these spots at home, and it takes only a few seconds. Instead of looking at the mark, close your eyes and gently run your fingertip across it. You're relying on touch rather than sight. If the spot feels perfectly flat and smooth, so smooth that your finger can barely detect it, yet you can clearly see it with your eyes, you're most likely feeling a solar lentigo, the harmless age spot we've discussed throughout this video. These spots change the color of the skin without changing its texture. They sit quietly on the surface, creating discoloration but not altering the feel of the skin itself. Now pay attention if the sensation is different. Suppose your fingertip catches on a patch that feels rough, dry, gritty, or almost like fine sandpaper. It may even be easier to feel than to see. Sometimes it develops a thin scale that flakes away, only to return a few weeks later. That isn't a typical age spot. It may be an actinic keratosis, a precancerous skin lesion caused by years of ultraviolet damage. Both the Cleveland Clinic and the Mayo Clinic emphasize that while many actinic keratoses never become cancer, a small percentage eventually develop into squamous cell carcinoma if left untreated. The challenge is that nobody can accurately predict which one will progress. That's precisely why dermatologists recommend treating them rather than waiting to see what happens. Fortunately, treatment is usually quick and straightforward. A brief application of liquid nitrogen often removes the damaged cells before they ever become something more serious. If you discover a rough, persistent patch on your scalp, forehead, ears, face, or the backs of your hands, don't assume moisturizer will solve the problem. Don't sand it down, pick at it, or simply ignore it. Arrange to have it examined. Another common growth appears very differently. It tends to be raised above the surrounding skin, with a waxy or slightly greasy appearance, almost as though someone placed a small drop of melted candle wax on the surface and let it harden. Sometimes you can even catch the edge gently with a fingernail. These growths are called seborrheic keratoses. They're extremely common after the age of 60 and are almost always harmless. While they can become irritating if clothing rubs against them or if they appear in noticeable areas, they don't represent skin cancer. If they bother you, a dermatologist can often remove them through freezing, shaving, or other simple office procedures. The important point is understanding that not every raised spot means danger, just as not every flat brown mark should automatically be dismissed. However, there is one category that deserves immediate attention because early recognition can truly save lives. Any spot that begins changing deserves respect. Watch for a mark that gradually grows larger, develops uneven or blurred borders, contains several different shades such as brown, black, red, or gray, or becomes wider than a pencil eraser while continuing to expand. Pay attention if it starts itching without explanation, bleeds easily, forms a sore that refuses to heal, or if a dark streak suddenly appears beneath a fingernail or toenail. These warning signs form part of the well-known ABCDE guidelines promoted by the National Cancer Institute to help identify suspicious pigmented lesions. One particular form of melanoma, known as lentigo maligna, often begins by looking almost identical to an ordinary age spot on the sun-exposed face of an older adult. It can spread slowly across the skin over several years, while friends, family members, and sometimes even the individual themselves continue referring to it as just another age spot. That's exactly why appearance alone should never become the final answer. I don't tell you this to create fear. In fact, my goal is the opposite. Most of the brown spots on your skin are harmless. The point is simply this. The phrase, "it's just age," should be the conclusion reached after someone knowledgeable has examined the spot, not the reason no one ever looks at it in the first place. If one mark seems noticeably different from every other spot on your body, trust that instinct. Dermatologists even have a name for this observation. They call it the ugly duckling sign. Just as one duckling looks different from the rest, the one unusual spot among many ordinary ones deserves closer attention. It doesn't mean it's cancer, it simply means it's worth evaluating. When it comes to skin health, paying attention early is always easier than dealing with problems later. So let's bring everything together into 5 practical actions you can begin this week. First, remember what these spots really are. They're solar lentigines, records of years spent in sunlight, not signs of liver disease. The pigment-producing cells responsible for them are still alive, and they're still capable of responding to healthier signals. Second, consider adding a 5% niacinamide serum to your evening routine. Apply it after cleansing and before moisturizing, not only to your face but also to the backs of your hands, where these spots commonly appear. Then be patient. Give your skin at least 8 to 12 weeks before deciding whether it's helping. Third, beginning tomorrow morning, apply a broad-spectrum sunscreen with an SPF of 30 or higher every day. Protect both your face and your hands. If hyperpigmentation is your main concern, consider using a tinted mineral sunscreen containing iron oxides for additional protection against visible light. Remember, cloudy weather and short trips in the car don't eliminate UVA exposure. Daily consistency matters far more than occasional perfection. Fourth, speak up during your next medical appointment. Instead of quietly accepting it's just age, try saying, "I'd like to discuss treatment options for the spots on my hands." Ask whether tretinoin might be appropriate. Ask about cryotherapy. Ask whether intense pulsed light therapy could help. These are reasonable questions, and you deserve thoughtful answers. Never feel embarrassed for asking about something that affects your confidence. Finally, perform the fingertip test tonight. Feel every brown mark you can comfortably reach. Smooth, flat discoloration is generally reassuring. Rough, gritty patches deserve evaluation. Any spot that's changing, bleeding, developing multiple colors, or steadily growing should be examined promptly rather than waiting until next year. And perhaps the most important message of all is this: set realistic expectations. If you choose creams, expect gradual fading over the course of several months, not overnight transformation. If you pursue medical procedures, results may appear sooner, but protecting your skin afterward remains essential. Sunscreen doesn't erase yesterday's damage. It helps prevent tomorrow's damage from becoming today's problem a few years from now. Every day you reduce unnecessary ultraviolet exposure, you make it less likely that another brown spot will quietly develop in the same place. As we finish, I want you to remember something simple. Your hands tell the story of your life. They've held newborn grandchildren, prepared countless meals, built careers, comforted loved ones, planted gardens, carried groceries, written letters, and worked harder than almost any other part of your body. Those spots are evidence of years fully lived, not something to be ashamed of. But caring for your skin doesn't mean you're trying to erase your history. It means you're protecting your health and preserving the body that has carried you through every chapter of your life. You deserve that care at every age. If you found this information helpful, take a moment to subscribe and leave a like so more people can discover it. I'd also love to hear from you in the comments. Which of these 5 steps are you planning to start this week? Is it adding niacinamide, protecting your hands with sunscreen, scheduling a skin check, or finally asking your doctor about treatment options? I read your comments, and they often inspire future videos that answer the questions people over 60 are asking most. Until next time, remember this: healthy aging isn't about chasing perfection. It's about making informed choices that protect your future while respecting everything your body has already done for you. Tonight, before you go to bed, spend just 20 seconds caring for the backs of your hands. It may seem like a small habit, but small habits repeated consistently often create the biggest changes. Take care of yourself, stay curious about your health, and I'll see you again in the next video.